This patient was referred to me for endodontic retreatment of tooth number 14. Root canal was done a few years ago by the patient's general dentist, and you can see a periapical relucency right there, and patient has symptoms. This patient came to see me about 14 months ago for endodontic retreatment. And here's the data, as you can see, approximately 14 months ago. Situations like this, upper first molars, the reason for the infection is almost always a missed MB2. You miss the MB2, you leave necrotic tissue and microorganisms behind, and it only takes a few months, a few years for a periapical relucency to form and patient to start to have symptoms. So I knew what I was dealing with here. I don't need to take a CBCT. I already know very likely there is a missed MB2. This is immediately after I redid the root canal about 14 months ago, and lo and behold, you can see we were able to locate that missed MB2, and the MB2 was completely separate from MB1 canal. Sometimes MB2 joins the MB1, but in this case, completely separate, as you can see. This is another angulation, and I want you to appreciate the curvature of these canals as well. You can see the curvature, almost 90-degree curvature of these canals. You're not careful, you're gonna break files. And here's the date, as you can see, 14 months ago. And as I said, I did this in one appointment. Again, to those who advocate, push, force their dumb opinion that you will need at least 1 week of calcium hydroxide or like material intracanal medicament before you obturate. Nonsense. You don't need it. And let me show you the 14 months post-op. I did this again in one appointment, no intracanal medicaments of any sort, one appointment, endodontic retreatment. And this was yesterday, 14 months post-op of tooth number 14. As you can see, the periapical relucency is healed completely. Patient has no symptoms, tooth is in full function. And here's the date, 14 months post-op of tooth number 14.